I'm Dr. Herbert R. Slavin, MD. I practice internal medicine with a focus on functional medicine. We've been doing this for well over 20 years now because the approach that mainstream medicine uses, where they focus on disease and treating symptoms, didn't make sense to me. And the reason, I'll give you an example. Someone comes in with high blood pressure, you can give them a medication to lower the blood pressure, or you can determine what's causing their high blood pressure, address that cause, get the blood pressure back to normal, and they don't need to take medication. So that's really the distinction that we make here when we try to treat people. Okay. Back around 1989, I would think, I'm sitting in a hospital staff meeting, actually the Utilization Review Board meeting, and they gave me a couple of patients' charts to review. These are patients that had died in the hospital. And I remember this clearly because it seemed to me that these patients died unnecessarily. I'm going to tell you why they died. One was a woman in her late 80s, the other was in her early 90s. And they were in the hospital for bypass surgery. They had bypass surgery and they never left the hospital. So I'm thinking to myself, couldn't there have been some other treatment that these women could have had that would not have killed them? After all, they're kind of old already. Maybe there's a safer approach. Now remember, I said around 1989, back in Fort Lauderdale, and during that time, there was a doctor on the radio, Dr. Dan Ream, had a radio show, and he used to talk about chelation therapy. And there are a lot of patients getting chelation therapy. They do very well with it. It's an alternative treatment for cardiovascular disease. It helps improve the circulation throughout the body. And one of the treatments is for coronary artery disease. So he used to talk about it, and I have to tell you, this is not anything learned in medical school. But here he's talking about helping all these patients avoid bypass surgery, leg amputations, their diabetes improves. So I looked into it. By coincidence, I had a nurse working for me at the time that had worked for Dr. Ream previously, and she confirmed that she saw these patients getting better. And I looked into it and joined the American College for the Advancement of Medicine, ACAM. And this is the group that teaches doctors how to do chelation therapy and teaches doctors how to treat patients more naturally than just using drugs. And now if you look into the history of chelation therapy, that was actually a mainstream medicine treatment for coronary artery disease in the, say, early 1940s, and it was used up until the advent of the heart-lung bypass machine, which made it possible to do bypass surgery. But they were getting great results with chelation. Patients with angina, that's the chest pain heart patients experience with exertion, they were getting improvement with that. The pain would go away with chelation. It was written up in peer-reviewed journals at the time. But then they found a better way, well, not a better way, but a more lucrative way to treat the problem, and they switched over. Mainstream medicine, over and over again, if they have a choice between a less expensive treatment or a more expensive treatment, will always choose the more expensive treatment. And not necessarily for the patient's benefit, but for the economic benefit. So that was chelation, and then over the years, we've evolved into doing more and more types of treatments helping dysfunction. Now, the reason chelation is effective, again, is we're addressing the underlying cause of the problem. These patients have accumulated heavy metals like lead, arsenic, cadmium, and mercury. When you test these people, you see elevations in those heavy metals. All chelation does is removes them from the body, which allows the body now to heal itself. I always question patients and even other doctors. I said, if you don't remove the underlying cause of the problem, how do you expect your treatments to help? And that's across the board. You can pick any disease state, from cancer to heart disease to hypertension to high cholesterol. It's no different. If you don't address the underlying cause, you can give all the drugs in the world, but you haven't really gotten the patient better.